We resume our series on ACL rehabilitation following an athlete from injury all the way back onto the field. When we last left, Maddie had had an episode of left posterior knee pain while she was jogging. There was no specific mechanism of injury, but she had to stop her activity, so we sent her to the doctor and got an MRI. The findings of this MRI, as seen here, showed that she has torn her medial meniscus that had previously been repaired. You can see where the white infiltrates into the dark triangles that we would normally see. So it was decided that an arthroscopic debridement would be necessary. This procedure was done a couple weeks later. You can see the damaged portion here by the probe, a different color than the tissue around it. This was debrided as is seen here, and Dr. Schwartzberg did a tour of the knee to make sure nothing else was wrong, looked at the lateral meniscus, which was good, and looked at the ACL graft that he had put in previously, and saw that it was good as well, and there was no damage to those structures. She presented to our office for her initial evaluation about 7 days post-op. Now, we, of course, had talked to her since the procedure, checked in to see how everything was doing. I talked to her previously about starting doing her quad sets and working on her motion. So it was a few days later than normal for her to come into the office, but I knew she would already be started on her rehab, so I wasn't too worried about it. When she comes into the office, we take the Band-Aids off that were on her knee and saw that her portals really weren't closed that well. They'd been draining quite a bit. The lateral portal had been draining quite a bit. And so then we went through the process of putting some steri strips in place just to approximate the edges of the wound. We didn't want her to get any infection. We didn't want to develop any scar tissue or adhesions. And so we just decided to do this. Now, typically we have some of these in the office, and I have some in my training kit that I use when we cover field events. And a lot of our offices are located right next door to the physician's office. So if we need some supplies, sometimes we'll just go next door and get those. For people who haven't put steri strips in place, I mean, it's a very easy process. You're just putting down one end, and then you're approximating the two ends of the wound together with some tension, and then you stick them down. After this was done, I trimmed off the extra ends that were there that weren't going to stick down because she had a little bit of lotion on her skin from trying to scrub off the goo, and then we just put a Band-Aid on top. When I took a look at her motion then, she had from 0 to 126, was a good starting point. I got her to 130 passively. Then typically, again, we would start with some NMES, as you see here. She was able to get a good quad contraction. She'd been working on this at home and was at this point walking without an assistive device, and she was feeling stable. She had a lot less pain than she did after her ACL surgery, which is understandable because it didn't have to involve the bone. So she had a good quad set, moderate generalized swelling. She wasn't using any crutches, only had mild gait deficits. So we can progress her as tolerated based on her symptoms and her response to treatment. And once she gets to the point where she's jogging and doing her functional activities back on the field, we really don't have any restrictions of the ACL protocol because we've already exceeded the time frame for this. And really the only decision would be when she's able to return to play.